Welcome to The Explainer. We're here to take those really complex questions and turn them into answers that actually make sense.
Okay, so have you ever gotten lab results back and felt like you needed a decoder ring just to understand them? Especially with fertility, one single number can feel like this final, scary verdict. But here's the thing, it's almost never the whole story. So let's dive in and unpack some of the most common and confusing fertility questions to give you some real clarity.
We're going to start at the very beginning, the real beginning, our own genetics, by looking at a tough case involving recurrent pregnancy loss.
This is such a fantastic question from Leah. It gets right to the heart of how our chromosomes, our literal genetic blueprint, can play a huge role in fertility.
So what does this actually mean? Well, imagine you're building a house, but you have two slightly different sets of blueprints. Some construction crews are using one, and other crews are using the second one. That's kind of what a mosaic is. Some of your body's cells are following one genetic plan, while others are following another.
And this slide just shows that difference perfectly. On the left, you see a typical female karyotype, which is your personal chromosome map. It's 46XX. But a cell with Turner syndrome is 45X. It's completely missing an X chromosome. So if you have a mosaic condition, your body is a mix of both. And what this means is that some of your eggs are going to have that normal XX pattern, but others will have the single X pattern, which sadly is often the reason behind the miscarriages.
And this, right here, is why getting that diagnosis is so incredibly powerful. It's not just some label, it becomes a roadmap. It explains that the miscarriages are very likely happening because embryos with the 45X karyotype are implanting. But more importantly, it points directly to a solution, using IVF with genetic testing. This lets you specifically find and select the healthy 46XX embryos, which can dramatically increase the chance of a successful pregnancy.
Okay, so we've looked at the building blocks of our genetics. Now let's move on to the chemical messengers that pretty much run the whole show every single month, our hormones.
This is a perfect one. This question is a classic example of why context is king when you're looking at blood work. Seriously, a number without its context is totally meaningless. And in this case, the timing of the test changes absolutely everything.
Just look at this timeline. It shows the hormonal roller coaster of a typical cycle. Now, it's true that a high LH to FSH ratio can be a sign of PCOS, but here's the catch. That's only if it's measured at your baseline, around day 3 of your period. If you test around ovulation, you're measuring the natural LH surge. It's supposed to be high. That's what triggers the egg to release. So that result isn't a sign of a problem at all. It's a sign that your body's doing exactly what it's supposed to do.
And this really highlights a critical takeaway, So often, you have to be your own best advocate. Don't be afraid to ask why a test is being done and when the right time to do it is. Just understanding the basics can literally save you from getting the wrong diagnosis or the wrong treatment.
All right, now for the topic that causes so much anxiety. We're going to dig into a really powerful story about why one number is never, ever a final verdict.
So let me introduce you to Kate. She did everything right. She was trying for a few months, felt like maybe something was off, and she sought out testing early.
And then she got this result back, 0.057. Now, for a 33-year-old, a normal AMH level, which is a hormone that tells us about ovarian reserve, might be somewhere between 2 and 4. So this number, it's critically low. And let's be real, that's the kind of news that can just be completely devastating.
This whole situation brings up a massive question we hear all the time. What really matters more? How many eggs you have, or how good they are? And honestly, the answer to this question could change everything about your journey. It's the key to turning a scary number into an actual action plan.
If you get a low AMH result, this is probably the single most important thing to remember. Say it with me. Quantity does not equal quality. Your AMH level only gives you a hint about the quantity of eggs you have left. It tells you nothing, and I mean absolutely nothing, about the quality of those eggs. And when it comes down to it, it only takes one good quality egg to get pregnant.
So, if you get a number like Kate's, please don't panic. Here are the immediate, actionable steps you can talk about with your doctor. Number 1, get more data. Confirm it with something like an ultrasound, because labs can be wrong. 2, investigate why the number is low. And 3, shift your focus. Stop worrying about what you can't control, the quantity, and start focusing on what you can influence, the quality.
This is such a powerful reminder. Please, if you're under 37 and a clinic tells you that donor eggs are your only option, treat that as a red flag and go get a second opinion. Some clinic policies are designed to protect their success statistics, not necessarily to explore your full potential. A younger person with low AMH can still have excellent egg quality. Don't let one opinion slam a door that might still be wide open.
Okay, let's wrap this all up by looking at how you can make some really smart, strategic decisions for the road ahead. As you're making your plan, remember that lifestyle factors matter, and for both partners. Take THC and CBD, for example. The data is pretty clear that it can suppress the key brain signals needed for sperm production, and it can directly harm sperm quality. This is genuinely one of the most significant and controllable factors that can improve a couple's chances. Now, when it comes to treatments like IUI, managing your expectations is so important for your mental health. In a best-case scenario, you're looking at about a 20% success rate per cycle. So if it doesn't work the first time, that's not a failure. It just means you're in the 80% of people who will probably need to try again. You gotta remember, for most people, this is a marathon, not a sprint.
And finally, if a condition like endometriosis might be a factor, your whole strategy may need to shift. First things first, get a complete diagnosis, and that includes making sure your tubes have been checked. Since endo can literally cut IUI success rates in half, it's time to have a serious conversation about whether you should continue with that or maybe move on to more effective options like surgery or IVF.
You see the common thread through all of these different stories, right? It's that knowledge is your greatest asset. Getting a scary number or a confusing diagnosis can make you feel so powerless. But understanding what it actually means, what your next steps are, and what questions you need to ask, that's where you take your power back.
By really getting the why behind all the tests and treatments, you stop being a passenger and you become an active partner in your own care. You get to be the one in the driver's seat of your own health journey.